Hi, it's Dr. Centeno, and today we're going to go over a procedure that we can perform using your own body's platelets or bone marrow concentrate to help patients avoid discectomy surgery. So discectomy is where the doctor performs disc surgery, and basically they remove a part of the bulging disc. Now the problem with that is that weakens the disc and has some other big side effects. So the goal would obviously be to try to avoid that if at all possible. So we perform what we call a Perc Functional Spinal Unit or Perc-FSU procedure. It's very, very different than what you might get in a pain management clinic where they're injecting steroids, which can hurt the area, or ablating nerves, etc. The goal is to stabilize that area and reduce the swelling around the nerve. So we're talking about the low back or lumbar spine here. And that's a blow up of that area. So we see a couple things here. First, we see the disc, which is going to be here, and that's kind of a shock absorber between the vertebra. Then we've got the facet joint, which is back here. Now, what we're talking about here is something that looks like this, a disc bulge where the disc kind of pushes out a little bit, and there's an exiting nerve that comes by here. And that exiting nerve can get irritated because of the disc bulge. But it's not only the disc bulge. In addition, when you start to get a disc bulge, this whole segment starts to get sloppy. And it's really this sloppy motion that causes issues. So one of the things we address in the Perc-FSU procedure is that sloppy motion. And the problem with this sloppy motion, or what we call disc degeneration, is that that can lead to more disc bulging, and it's caused by loose ligaments and stabilizing muscles that aren't doing their jobs. So that sloppy motion, like I said, can cause disc bulges, can cause facet joint arthritis through the years, swelling in the spinal nerves, etc., etc. So what if we could treat that without invasive surgery? And this is the Perc-FSU procedure that we're discussing today, and that is focusing on tightening down the ligaments, reducing the swelling in the facet joints if that's there, reducing that swelling around the nerves and trying to inject something that'll help the nerves, and then try to help the muscle atrophy that often happens there that just allows too much motion. So again, focus is on ligaments, joints, around the nerve, and the muscles. So to do this, we usually use platelet-based procedures. So that's our third generation high-dose platelet lysate. So that's platelet growth factors. That's our third generation high-dose platelet-rich plasma. And stem cells are usually not required, but can sometimes be used in rare cases. And as a source of those stem cells, we would use your own bone marrow concentrate. So one of the things to be cautious about with this is that this is a highly specific procedure that Regenexx physicians are generally trained to perform. But you've got to use both X-ray and ultrasound guidance to do this right. It's not something that can be done inside a chiropractor's office by a nurse or a physician's assistant. And even interventional spine practices don't really have the ability to do this. They can do some of the other things we've talked about, like steroid shots, but when it comes to this type of procedure, most don't have the training for it. So in conclusion, every year as a national network, Regenexx helps thousands of patients avoid low back surgery, and we'd love to see if you're a good candidate for this procedure. Thanks so much for watching, and have a great day.